Hi guys, welcome back to my channel. So today I thought I would do a clinical experience at UofT video. So before I start, I just want to say that my clinicals have been different because of the current pandemic. So the way that things are run are going to be slightly different than if you are taking this program when a pandemic is not going on. So to start off, we are currently in January, so I'm in a different clinical placement. But I just finished my first rotation last year, ended in December, in a mental health setting. So at UofT, they normally do 2 clinical rotations. So the first semester will be mental health and older person setting. But because of COVID, we had to choose either an older person setting or mental health. I chose mental health. My top choice was mental health at Toronto General, and I did get my top choice. How it works is that you go onto a website and you rank all your preferences, and it has all the choices there, and then the system will randomly assign you, and they will try and give you within your top 3, but it's not guaranteed. I know some people who got their last choice and I got my first choice. So it's just random, so you might not be put exactly where you want to be, but all clinical placements are good. You're gonna get a good experience wherever you go. In terms of how my experience was at Toronto General, it was amazing. I had a really good clinical instructor who was really good at lessening our anxiety. So there was 4 of us. Usually there is 8 to 10, but because of COVID, they lessened the group, so there was only 4 of us, which was great. We had a lot of one-on-one. He got to know us on the first day. We had a little bit of an orientation. We got to go home earlier on the first day. He really just explained the unit to us. He took us on the unit for a tour. He explained safety things, what was expected of us, and that's about it. And really, it was more of what we think the clinical will bring to us, how we were feeling. They really put an emphasis on like the transition from not being a nurse, like not knowing anything about nursing, just entering the program, to entering a clinical setting. They realize that it's a huge jump and a lot of students are not ready, or you don't really feel ready, so they kind of teach you a little bit of a fake it till you make it kind of thing, and that's exactly what I did. That's exactly what my colleagues did. I had a lot of imposter syndrome in the first term, because as soon as you put your scrubs on and you put on the stethoscope and all the gear, and you have your notebooks, and you're walking around, you have to start being a nurse because people will start treating you like one. Obviously you're still a student, but you might not know, you might feel like you don't know anything, and really it's just kind of showing a little bit of confidence and asking a lot of questions, and they make it easy for you. Like, the clinical instructor never leaves you alone. If you're not comfortable with something, they don't really give you a lot of responsibility in the first term, and they always ask you whether you're okay with something or not before you do it. So in the mental health setting, we did a lot of interviews. We did MSEs, mental status examination. I think that's what it stands for. Honestly, can't remember. But we did that. It was like just a little bit of like a questionnaire things. When you walk into your patient's room, you ask them questions like, how'd you sleep? Are you hearing anything or seeing anything? Those kinds of things, suicidal ideations. So it's really teaching you how to ask those kinds of questions, how to interact with your patient, especially if they have certain conditions, like if they're schizophrenic, or they have delusions, hallucinations, or they're psychotic right now, like those kinds of things. It really exposes you to how to deal with patients in that state, and how to provide the best care to those patients. And you're also doing the vitals for your patients throughout your rotation. So the transition from the first week, again, it was just orientation. Then the second week, we just shadowed a nurse. We got to see what the kinds of things they did. We were not allowed to give medications in the first semester, but we got to witness it, and we did get to, around the 2nd to 3rd week, you got to take the vitals. You had a friend come in the room with you. You had the clinical instructor come with you, because this is the first time you're really interacting with the patient. You're doing something physical with them, so it's really daunting, but they really help you so that you're not just thrown into it and you're not alone. You're never alone. they understand that it's a big jump for everybody. So, and then they also have post-conference at the end of the day where you guys all come together and we just talk about our day and what we saw. In the mental health setting, we saw a lot of things. We were one of the groups that our clinical instructor said these kinds of things don't normally happen. Again, we're in a pandemic, and maybe that's what, I don't know. There's a lot of cases in there that he said is not normal, but it was great because we got to see it, we got to experience it, and now we know how to deal with it. So again, you're going to experience a lot, you're going to see a lot, and you're going to really reflect during those post conferences where you can talk about it and really be open about how you're feeling. And in terms of the evaluation in your clinicals, they have a midterm, and the midterm is just around the halfway point. You go in and you have a one-on-one with your clinical instructor. So you just talk about what you've been doing right, what you want to work on, things you might want to be exposed to more, how you feel the clinical instructor is doing. It's just more of a conversation. And then at the end of the term, you do a quick survey online where you fill out a little form about the clinical placement, what you did. They really just want to know that you got what your experience was like. And normally people pass, they don't really fail. A lot of people, you only fail if you fail to show up, or you come late all the time, or you're not following the rules. Again, maybe you're not dressed appropriately, you're doing unsafe things, those kinds of things, but it's really rare to have that in a clinical setting. So again, as you start to move on with the clinicals, you start to become more familiar, and then by the end of it, I was able to take on 2 patients. During the midterm, my clinical instructor said that, I think you're ready to take on 2 patients if you feel ready for it. And basically what that means is that you're basically responsible for that patient, obviously not medication-wise, but you go in, you do their vitals, you log it in the computer, you do their charting, you do their assessment, make sure they have breakfast, that if there's any concerns, if they have appointments to go to, you monitor that, those kinds of things. In the mental health setting, there's not that many physical ailments you see with patients, but there were a few here and there, like IVs or wound care. And because it was our first rotation, we didn't exactly do that stuff, but we saw it and we were able to see how to do it. So we were able to be exposed to it. So I really did enjoy that. Now I'm in second semester. So your rotations are broken up into 3 categories. I think it's the same for when COVID isn't happening, but again, I can't be sure because I don't know. But the first rotation, I'm in acute care. And then I go to pediatrics, and then I go to maternal health. So the whole group of students gets broken into 3. So my friend, for example, that was in mental health with me, she's in a different rotation first. I think she's in peds first, versus I'm in acute care first. So the group of people are broken again into 3, and then you travel with your group. But within that group, you get put into different placements depending on what you want. But if you're in acute first, you're going to go with that same group to peds next, and then maternal last part of the semester. So I'm in acute care right now. I'm at Mount Sinai, and I do 1 12-hour shift a week for 7 weeks. And then we have a little bit of a break, and then I'm going to move on to another place. And I don't know exactly where that is yet. We're going to have to do that process where we vote and we choose where we want to go. And then you see where you go within peds, what hospital, and then that's for a month. And then again, a little short break, and then a month in maternal health. So right now I'm in acute care at Mount Sinai, like I said. I'm with, again, 4 students. And so acute care is a lot different than mental health. Those of us that were in mental health, some of us, again, were in older person care settings in first semester versus mental health. So those people that were in older care settings in my group had a little more physical exposure versus those in mental health did not. But again, if I had to choose, I would still choose doing mental health because I can kind of see how it fits in with every patient population. So in acute care, we do have mental health patients still, those who have a physical ailment as well as a mental health condition. So you always need to bring those skills that you learned with you to any other unit you're on. So I'm really happy I did that rotation. It really opened my mind into how mental health works, what to expect, and really how to provide best care. So anyways, I'm in acute care right now, 1 12-hour shift a week for 7 weeks. Some people have, again, block rotation. In my first rotation, I had a block rotation, which meant that I was in 2 8-hour shifts a week for a month. And some people didn't have block rotations. They just had 1 8-hour shift a week for 2 months. Again, it's a COVID thing, so you don't really have to worry about that if you're taking this course not in COVID time. It's not really ideal that you have 2 8-hour shifts a week with the full course load. That brought a lot of stress for us, especially my group that was in the latter half of the term. So some of them had only the beginning half of the term, 2 shifts a week, and there was like nothing due in the beginning half. It was really, I think the program, I can do a video on how the program is myself, like in itself, the schoolwork part of it. But it was very light in the beginning, but the second half was really rough. There was a lot of due dates, a lot of exams, midterms, group projects. And when you're in 2 8-hour shifts a week, it's really hard to go home and start working on that kind of stuff that you need to get done because you're already drained from clinical. So yeah, it was really tough, but if you reach out to the faculty, they are really understanding, and especially in a time like this, they'll give you extensions if you ask, if you're really having a tough time. Anyway, so now I'm not in a block rotation. I know people in block rotations. I know Sick Kids is doing a block rotation. They're doing 2 12-hour shifts a week, which again is really tough. I got lucky that I only have 1 12-hour shift a week. But yeah, you always end up doing the same amount, but it just depends like the duration. So again, nobody gets more clinical than another person. And it's a strange time. I know some of the people in my first term actually got COVID. So they're missing out on their clinicals right now. Obviously, they're going to have accommodations because it's something that you can't really control. But you are exposed in my acute care setting. We have COVID patients on our floor. We're mask fit tested now, so that got delayed because of COVID. But we're going to be working closely with COVID patients next week because our instructor said to bring your N95 masks, so make sure you're ready for that. They really throw you into it, but again, she's like, I'm enjoying it. I'm one of those people that's very anxious, so I thought, oh my god, like I don't know what I'm doing. But the way they teach you is like they go slowly, but not too slow that you don't feel like you're learning enough. It's really like a step back and give and take. So if you're having trouble, you go to your clinical instructor and say, hey, I need extra help with this, and they will help you with it. They're there to help you, as well as the nurses that you're working with. So for example, I gave my first IV medication yesterday. My clinical instructor was there to help me. They're always going to be there with you when you do that kind of stuff. You don't do it alone, especially we're first years. Technically, we're first years. So you need to have supervision while you're doing it, when you're giving medications. So now this term we can give medications now. So you're going to have a lot more responsibility. We're going to be taking on more patients. And like you do the, again, vitals in the system. You're learning how to take on a patient and their whole history and what the care you need to do for them. Every patient is different. So for example, I have a patient that has heart failure. That means that I need to make sure she gets her medications at the right time. So I have to check the system. When is she due for her medication? I have to make sure I grab the medication. If she has things that I need to do before I give that medication, like take her vitals, I need to go take her vitals. I need to make sure that they're in the safe range before I give that medication. If she wants to take a shower, if she needs assistance, I need to assist her. Again, this is all stuff you do with the clinical instructor. You never just do it alone. We also get put in pairs so that we're not feeling overwhelmed, or if we have any questions, we can kind of lean on our peer. That kind of stuff. And again, you're learning the entire time. We're also doing a project for school based on a patient in clinical. It's really tough right now because you have to balance both. Ideally, I wish we weren't doing a project on a clinical patient because it takes away from learning with the patient. But like I said, it's all interconnected. So you're really learning a lot as you go through. So I'm starting my 3rd week in acute care next week. I feel like I've learned a lot this week alone. Within 12 hours, you can learn a lot about the different tools. I know when you're first introduced to the different mechanisms like G-tube feeding and wound care assessments and all the different primary, secondary lines of IVs, like you start to like lose it all up here. But once you see it in clinical practice, it becomes a lot easier. So that was a lot of information, but that was kind of how my experience went. It's like I went in really nervous, like I don't know what I'm doing, and they just throw you in it. And it's not really like that. They throw you in it, but in a good way. Like they're there for you. It's really like you have to take initiative though. You really need to stay on top of stuff, and you need to make sure if you have questions you ask. You need to try, in terms of like if you need to look up something, take the initiative to look it up. Don't do anything unsafe. But it's a lot of fun. Like if you're in nursing for the right reasons, then you're really gonna start seeing what it is. Like they don't make you wait to actually experience it. They let you experience it right away, and they let you experience like the worst case if that is it, like COVID patients, for example, because we're in a pandemic. Once you graduate, you're gonna have to work with COVID patients, so they don't shelter us from that. They let us see and let us be a part of everything. So yeah, you'll do great. The imposter syndrome kind of fades as you go on. You kind of build your confidence as you go. And everyone learns different paces. I think it's really good to lean on your peers as you're doing this, because talking with them in those post-conferences and just opening up about how you're feeling, and if you have any questions, sometimes your peers can help you. So I highly recommend doing that as well. I really enjoy the experiences right now. Again, Toronto General and Mount Sinai right now, and hopefully my peds clinical. I can also make a little video on peds and maternal once I finish that. But I'm really enjoying it. I'm really enjoying the program. It's a lot of work, but definitely worth it. I don't hate getting up at 5 a.m. and doing a 12-hour shift, because I enjoy being there and I enjoy learning what I'm doing. So yeah, if you have any other questions, any other content that you want to see, if you want me to do a review of how the course worked and how I did, I can like update how I did in the first term. I know I gave my GPA away for my last undergrad, so I can maybe keep you updated on how my GPA is doing right now and how I'm getting the GPA that I'm getting. If you want to see all of that, comment, subscribe, like, so that I know that it's worth making these videos. Anyways, thank you guys for watching.